We are here today to talk about ways to reduce central line bloodstream infections, best known as CLABSIs. Although the rate of CLABSI infections has been dramatically reduced in hospitals across the country, according to the CDC, there are still approximately 41,000 infections that occur annually. We have found that the national goal of a 50% reduction in CLABSI can be exceeded through the use of a multifaceted approach that includes specific maintenance bundle elements and organizational engagement. With me today is Dr. Rinwa Dumyati from the University of Rochester in Rochester, New York. She was instrumental in the development of our maintenance bundle and has just completed a 5-year study on CLABSI reduction. Dr. Dumyati, can you tell us about the elements that you have found to be important for CLABSI reduction?
We did a study at 6 hospitals in the Rochester, New York area. And we focused mostly on prevention of central line infections or bloodstream infection, or CLABSI, outside the ICU. We did it at a time when no one was focusing on central line infection outside the ICU. There was a lot of attention in the intensive care unit because in our state, the disease is reportable to the New York State Health Department. It is very important to reduce this type of infection because of the morbidity and mortality associated with this disease. We focused beyond the insertion. If central line remain in place for a longer period of time, maintenance becomes very important. The maintenance mostly is done by nurses. So the nurses really are key in knowing what the bundle components are. For a proper insertion, you need to maintain aseptic technique, and there is a bundle of 5 elements that have been used nationally that have reduced the rate by more than 50%. The procedures that are in the maintenance bundle consist of hand hygiene before you access the central line. Anytime you touch it, you change the dressing, nurses should perform hand hygiene. The second thing they have to do is whenever they're going to push medication or draw blood from the central line, they have to scrub really thoroughly the needless access device, or what some people call the hub of the central line. Central line infection is due to bacteria. Usually they colonize the line. They can come in through the skin, where the line goes in, or they can come in at the end of the central line where the needless access device or the hub is. So if we don't clean both those sites, the bacteria can get either on the outside of the central line or inside. The third thing they have to do is when they change the dressing to use chlorhexidine to clean the site and make sure that they use it for a long period of time. We recommended 30 seconds. And the dressing should be changed every 7 days if it is a transparent dressing, and if it's a gauze dressing, every 48 hours. When staff change the dressing of the central line, they have to make sure that everything that gets in contact with the patient's skin and the central line need to be clean, basically aseptic. They have to use aseptic technique. The next thing is the frequency of changing the tubing and the needless access device, and that also has to be documented that it was done so people can pay attention if someone forgot to do it. And the last thing is to have a system where you could track how many central line are in and are they still needed, so you could remove them. And having a central line like a PICC line makes the patients happy because you don't have to stick them every time you have to draw blood. It's very important to educate patients that if we tell you really we have to remove that central line, it's for your own good. We're doing it so there is a less risk of infection. It is very important to educate the nursing staff on what are the best methods to prevent central line infection. Education and engagement are both important, and then sustainability is the key. First of all, you measure, and then you improve, and it's important to continue the measurement and to keep people aware and engaged and to keep feeding the result to show them sustaining the reduction. So it's very important that you really keep track of your data and see if you had the reduction that it stays down, and if there is any change to understand why that change happened. You have to make the process become part of the day-to-day action, so they don't have to think about it. You take it to a level where they become part of the routine.
Thank you, Dr. Dumyati, for the enlightening overview. And we hope we've given all of you an insight as to what you need to do to reduce CLABSIs in your facility.